Neuro Vital Signs Assessment.
Good day everyone, my name is Gino Tibulando, a third year BSN student of NDDU. So for today, we're going to perform Neuro Vital Signs Assessment. So it is a process of evaluating the level of consciousness using the tool, the Glasgow Coma Scale or the Neuro Vital Signs Scale. It is a key component in the care of the neurologic patient, which it helps detect the presence of any neurologic diseases or injury. The purposes of having this assessment is first to assess the patient's level of consciousness, second is to establish baseline data to compare subsequent assessment findings, third is to detect any presence of neurologic diseases or disorder, and last is to determine the type of care to provided. Materials needed are the following. We should have a percussion hammer, a piece of cotton for assessing the light touch sensation, and lastly, we should have a sterile safety pin for tactile discrimination.
Assessment. Reviews physician's order for neurovital monitoring to ensure correct monitoring of patient. Assess reasons for this monitoring to determine the need for monitoring. Gather both subjective and objective data about the patient's previous or present health state to assess patient's level of consciousness and ability to cooperate. Gather all the materials or the equipment needed to prevent delay of the procedure and to save time and effort. Plan the need for assistance and other persons support during the procedure may facilitate the ease of the procedure. Implementation.
So, good day, ma'am. I am Gino Tibulando. You're attending
Introduces
for
self
today,
and
so we're
verifies
going
the
to
client's
perform a
identity,
neuro vital
explains
signs
to the client
assessment,
about
ma'am.
the procedure and
So,
discusses
during
how the
assessment,
results
ma'am,
will be used in
physician's
planning
order
further
ni ma'am
care
na
or
kailangan mo.
treatments.
So, during mga
To
assessment,
ensure
ma'am,
procedure
determine
is
mo ang
done
pinaka-level
correctly
of
to the
consciousness na
patient,
meron ka.
explain the
Tapos,
procedure
pag-determine
will
sila mo ang
alleviate
what type of
anxiety
care
and
na
gain
mo provide sa inyo,
cooperation
ma'am.
from the patient.
Okay, ma'am. So, kung itong pangalan, ma'am?
Jonah Fieldad, sir.
Okay. Tapos, akaga po yo.
Poblasyon Malungon po.
Lagay niyo mong edad, ma'am.
20 po, sir.
Okay.
Perform hand hygiene and observe other appropriate infection prevention procedures. Reduces transmission of microorganisms. Check vital signs. Evaluation of the client's vital signs should be conducted as current or progressive injury to the brain and the brain stem may make vital signs unstable, which could reduce neurologic responses.
Tapos, may ginabatsag ka ba?
Wala, sir.
Ask for any history of any neurological problems to provide baseline data and will assist in formulating an etiologic and or
Bakit
pathologic
problema sa imong sa
responses.
imong pagkaon,
Wala po, sir.
sa imong sa imong vision, wala ma'am? Wala man lang. Okay, very good. We're going to assess the language
Assess any
of the
difficulty
patient
in
for today.
speaking.
So, masaya makita ni ma'am.
Point common objects and ask client to name
So,
it.
kani ma'am, saan ni siya?
K.
Very good. Wala ka yung head.
Ask client to respond to
Okay,
simple
yung left
verbal
arm,
and
ma'am.
written commands.
Sa imong right arm.
Ari, sir.
sa imong
This will
mga
assess
toes.
if the level of speech delivered at a normal rate and the volume or is pressured, slow, or accented.
So,
Assess the client's orientation to time, place, and person.
AM, sir.
kabalo ka karon.
Hospital po, sir.
Checks degree of mental orientation and establishes alertness by evaluating for sleepiness, disinterest, or distractibility.
Poblasyon Malungon, sir.
Very good. Kasi pangalan sa imong pamilya,
Robert Fieldad po.
tapos naimanghod ka.
Kuya po, John Michael Fieldad.
Going to ask a series of 3D.
Assess any lapses in memory. This will provide early detection of dementia.
3 digits of numbers. So for
Assessing the immediate recall.
7, 5, 3.
7,
Ask client to repeat series of 3 digits. Gradually increase the number of digits until the client fails to repeat the series correctly.
So 7, 5, 3, 2, 1, 6.
7, 5, 3, 2, 1, 6. 7, 5, 3, 2, 1,
So this
Start
time, ma'am, I
again with
will
a
going
series of
to
3 digits, but this time ask the
repeat
client to
the
repeat them
digits, but
backward.
you should able to repeat them backward, ma'am. So 753 216. So 612357.
612 357. 612 357.
Very good. Asa
To
ka karon,
assess
ma'am, ug
recent
nga
memory,
nakapadaling?
ask the client to recall the recent events of the day, such as how the client got to the clinic. This information must be
Kailangan
validated,
sa mong doktor,
however.
sa mong doktor.
Ask the client to recall information given early in the interview. Example, the name of the
To
doctor.
assess the remote memory of the patient. So, 20 years old ka
Ask
naman
the
na mo.
client to
So,
describe a
libo jud
previous
ka, ma'am.
illness or surgery,
So,
example,
pwede mo
5
i-stay
years
kay
ago,
pangtabo sa
or a
libo.
birthday or anniversary generally. Remote memory will be intact until late in neurologic pathology. It is at least useful in assessing acute neurologic problems.
Then, napod akong mga friends, then family.
Ay, thank you. Attention span and calculation. So, ma'am, recite
Ask the
A, B,
client
C
to recite the alphabet
Z.
or to count backward from 100. Test the ability to calculate by asking the client to subtract 7 or 3 progressively from 100.
R, S, T, U, V, W, X, Y, and Z.
Okay. So, 100 minus 3.
This will determine the amount of time
Minus
spent
3.
concentrating on a task before becoming
Okay,
distracted.
minus 3.
91, sir.
Okay, minus 3.
88, sir.
Okay, minus 3.
85, sir.
Minus 3.
82, sir.
Okay, very good.
Assess LOC using Glasgow Coma Scale. Apply the Glasgow Coma Scale using the eye response, motor response, and verbal response. An assessment totaling 15 points indicates the client is alert and completely oriented. A comatose client scores 7 or less.
Sa front sa imong kuan sa imong
Evaluation of LOC is the most important part of the neuro exam, as a change is usually the first indication of a declining
Pila imong
status.
height, ma'am, in centimeter?
148, sir.
Okay.
Check client's pupil size, shape, and equality. Turn the pen light on and position it lateral to the eye in the same plane. Slowly bring it over to shine directly on the pupil and observe for the reaction of pupil to light. A change in pupillary response, such as unequal or dilated pupils, can provide a warning sign on increasing intracranial pressure. Assess any problems in cranial nerves. It will provide information regarding the transmission of motor and sensory messages, primarily to the head and neck.
Next, kay kanang focus lang agad, ma'am, tapos ayaw mong i-move imong head, tapos akong ano ang i-move ang object ha.
Test reflexes. It will provide clues to the integrity of deep and superficial reflexes. Stroke the lateral border of the sole of the client's foot, starting at the heel, continuing to the ball of the foot, and then proceeding across the ball of the foot toward the big toe. Assessing gross motor and balance test. Walking gait. Ask the client to walk across the room and back and assess the client's gait.
Twice, ma'am. Thank you.
Romberg
stand up
test.
straight, ma'am.
Ask the client to stand with feet together and arms resting at the sides. First, with eyes open, then closed. Stand closed
Close
during
your
this
eyes,
test.
ma'am. Okay. Stand up straight, ma'am.
Standing
Then
on
open.
one foot with
Close your
eyes closed.
then
Ask the client to
lift up
close
your
the
right
eyes and
foot,
stand
ma'am.
on one foot.
1, 2, 3,
Repeat
4,
on the
5.
other
Then your
foot.
second foot, ma'am.
Stand close to the client
1, 2,
during
3,
this
4, 5.
test.
Very good. Walk in a straight
Heel
line, ma'am.
toe
Then your
walking.
heel
Ask the
must
client to
touch
walk
your
a straight
toe,
line,
ma'am.
placing the
And
heel of
so
one
on,
foot
ma'am.
directly in front of the toes of the other foot.
Okay, stop. So,
Two or heel
walks,
walking. Ask the
several
client to walk
steps,
several
ma'am,
steps
is
on
either
the
heel
toes
or
and
toe,
then
ma'am.
on the
So,
heels.
So extend your
Fine
fingers,
motor
ma'am,
test for the
sa
upper
shoulder level.
extremities.
Tapos
Finger to
point
nose
your
test.
nose using
Ask the
your
client to
left
abduct and extend
hand
the arms
palm.
at shoulder height and
Then
then rapidly
your
touch
right
the nose
hand palm.
alternately with one
Then do
index
it
finger
alternately,
and then
ma'am.
the other.
1, 2, 3, 4. Thank you. So, ma'am, pat your
Alternating supination and
knees
pronation of
using
hands
with
on
your
knees.
palms of the
Ask the
hands and the
client
back
to
of the
pat
hands.
both knees
And do
with the
it
palms of
alternately.
both hands and
Go.
then with the backs of the hands,
1,
alternately at an ever increasing
good in
rate.
increasing rate, ma'am. Yan. Very good. So, ma'am, point your nose, ma'am, with your
Finger to
fingers,
nose
ma'am.
and
Then,
to the
you're not
nurse's
able to
finger.
touch with
Ask the
this one
client to
with your
touch the
hands,
nose
ma'am.
and then
So,
your index finger, held at a distance of about 45 cm at a rapid and increasing rate.
thank you. Extend your both arms, ma'am, in the shoulder
Fingers to
level.
fingers.
Then
Ask
you're
the
able
client to
to
spread the
meet
arms
your both
broadly at
hands at the
shoulder
midline
height
of your
and then
body.
bring the fingers together at the midline.
And do it,
First
ma'am,
with
in
the eyes
increasing
open
rate.
and then closed. First slowly and then rapidly.
Thank you. With your right hands, ma'am, you
Fingers
must
to
able
thumb.
to
Ask the client to
touch
touch each finger of one
your
hand to the thumb of the
thumb
same hand
using
as rapidly
the
as
fingers of
possible.
your hands, ma'am, in an alternate pattern. Ganyan. Ah, do it in an increase. Yan. Put your one
Assessing
foot
fine motor
just
tests
below
for
the
lower
knee, then touch
extremities.
your
Heel
shin
down
part.
opposite shin. Ask the client to place the heel of one
Then do
foot
it to
just
the
below the
other
opposite
part.
knee and run the heel down the shin to the foot. Repeat with the other foot.
Okay,
Toe
so
or ball of foot to the nurse's finger. Ask the
you
client to
must able
touch
to
your
touch
finger with
the
the
finger,
large
ma'am,
toe of
using
each
your
foot.
big toe,
The
ma'am.
ability to perform these tasks requires properly functioning pyramidal and extrapyramidal tract sensation and coordination.
So for this, ma'am, I'm
Assessing
going to
light
use
touch sensation. This will evaluate the
So I'm
presence of
going to touch
anesthesia,
specific
hypoesthesia,
parts of
and
your
hyperesthesia.
body. Then after
Ask the
feel it,
client to
ma'am,
close the
then
eyes
say
and to
yes, ma'am.
respond
And
by
if you don't
saying
feel
yes
it,
or
say
no
no, ma'am.
whenever the client
Then
feels the cotton
kindly
mist
close
touching
your
the
eyes,
skin.
ma'am.
Test areas on the forehead, cheek, hand, lower arm, abdomen, foot, and lower leg. Check distal area of the limb first, the hand before the arm and the foot before the leg.
Yes. 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 Yes.
For today, ma'am, I'm going to assess, ma'am, your
Assessing
pain
pain
sensation, ma'am.
sensation.
So I'm
Ask the
going
client to
to
close the eyes and to
touch you
say
with
sharp,
this
dull, or don't
object,
know when
ma'am.
the
That's
sharp or
your
dull end of a
pin,
safety
ma'am.
pin is
Safety
felt.
pin. So if
Alternately,
you
use the
don't feel,
sharp and
if you
dull
feel the
end to
pain,
lightly
ma'am,
prick
just say
designated
sharp. And if
anatomic
you
areas
don't
at
feel the
random.
pain, just say dull. So close your eyes, ma'am.
This will evaluate if the client has analgesia, hypoalgesia, or hyperalgesia.
Sharp. Sharp. Dull. Dull.
Very good. So give me your hand, ma'am. So
Position or kinesthetic
close your
sensation.
eyes, ma'am. So
Ask the
I'm
client
going
to
to
close the
grab your
eyes,
middle
grasp a middle
finger.
finger or
Then
big toe firmly
if
between your thumb and
identify the
index finger.
position, ma'am.
Move the finger or two until it's up, down, or straight out and ask the client to it. This will evaluate the ability to sense motion of a joint or limb. Evaluation. Client relates in logical sequential manner. Questions are answered appropriately and without distraction. Client is able to easily and accurately recall history and facts. Explain findings to the client within the nurse's scope of practice and function. Cleans the area and returns borrowed materials and documents findings in the client record.